Lindsey, it's really kind of you to come back after the trauma of the last interview with me. I really appreciate you coming back.
Yes, I survived. I'm happy to be back.
Yeah,
Thank you.
you're tough. You're tough, that's for sure. Now, I know you've been doing some work with masks, Lindsey, and mask wearing. I mean, do you think this is an important way to prevent spread of infection?
Yes, I do. I think that now the evidence is quite clear that masking can be very helpful. And it's helpful not only for prevention of disease. I mean, it is for prevention of disease, but it can help maybe protect our economy so we don't have to shut things down again. I think the evidence is there. And so it's one tool we have in our toolkit now that we can use.
So we could close down the economy at the cost of about $1 billion a day, or we could wear masks. You can kind of take your pick, really.
That's right. That's right. Make your choice. Make your choice.
It's just crazy.
Be wise.
Yeah, it's just crazy. It's a real motherhood and apple pie type question, isn't it? You know, it's yeah. But surely masks produce a sense of false security, don't they? And people are more likely to spread the infection.
I don't think that people are not more likely to spread the infection, but and I don't think that it does cause people to, stop washing their hands, stop distancing, that kind of thing. I think that was a concern at the beginning, but I don't think that there's evidence for that anymore. I think that it's definitely something we can use to prevent further spread of infection. It's just simple, right? Just put the mask on.
Okay, I'm convinced about that. Okay, I take that back. Right, I'm convinced. but I think the point is it's an as well as, isn't it? That's the serious point.
Yes, it's in addition to these measures that we already have, right? It's one more tool that we have in our toolkit, and I think that it's we haven't had the evidence for it until recently, so it's something that takes a little bit of time for people to get on board with. But now it's something that I think is going to be definitely essential, indoors in public places, and when you cannot physical distance.
Yeah, so. I mean, and the evidence now is just unequivocal, isn't it? I mean, the droplets, obviously, but the aerosolization now, the evidence for the aerosolization is now pretty strong.
That's right.
You can get the viral particles in very, very small water droplets, about 5 microns in diameter and less, smaller than a red blood cell. They evaporate some more and form these tiny nuclei that just float around in the air for who knows how long.
That's right.
Probably several hours is the answer, but and just to me, there's two things that are just so important that aren't being done. There's the mask wearing, and the ventilation.
Yes.
Open the windows, open the doors.
That's right.
Dilute the viral load.
That's right.
This is not complicated, but I think you've come across a problem of a genuine difficulty, to be quite serious, of people who have difficulty wearing masks. What is the difficulty there?
Yeah, and I've had some people approach me, and my ideas on masks have evolved with the evidence that's come in, right? So at the beginning, people were saying, "Do you think people should wear masks?" I said, "Well, I don't know. There's no real evidence." And now we do have that clear evidence. And I've had people approach me and say, "I've tried wearing a mask. It's been very difficult. I don't feel well when I wear the mask, or my breathing starts to change when I wear the mask." And up until recently, I haven't really understood that or had a response. But I was consulting with a doctor from the University of Toronto, and she was saying that it's actually a real thing. Mask anxiety is a real thing. It's something that, our brain senses that there's something over this area of our face. There is a very small change in maybe CO2 levels. It's very small. It is not harmful, but that does sometimes in some people cause a little bit of a trigger to go off saying, "Listen, I'm suffocating. This is a danger. I need to get this mask off." And it produces panic. And when this happens, the person, takes the mask off and starts and just kind of comes to the conclusion, "I can't wear a mask. I cannot do this." And, this video that I did, my sister-in-law, who's in Brazil, down there, if you're even in an apartment building, if you're not in your own apartment, you have to be wearing a mask. And she had an experience last week, I think it was, where she started to panic. She said it was very hot. I was carrying some things, and I just my breathing started to get really quick. And she said, "I remembered your mask video, and I was able to calm myself down." I said, "Did you take the mask off?" And she said, "No, I couldn't, but I was able to calm myself down." And I realized that the mask was not the problem. It's a psychological and a physiological response that can be controlled.
Yeah,
So
no, it's a real thing, of course. So are you happy
yes,
for people to watch your video now? Should we play it now?
yes, absolutely.
We'll play it now.
Sounds great.
Yeah.
Hello friends. Today I'm going to talk about how to wear a mask comfortably. Some people do have much difficulty when they wear a mask. They feel like they're being suffocated. They feel unwell. They feel difficulty breathing. I'm going to show you a way that you can overcome the feeling of discomfort or suffocation or panic when you're wearing a mask. As masks are becoming more of a reality of our day-to-day lives, I want to tell you that the sensation of wearing a mask and feeling like you are short of breath is very real. It is not something that we make up. It is a biological process. It is the way that our brain protects us from actual situations of suffocation. But it is also something that we can overcome. The feeling of suffocation is not unique to medical masks. This feeling also occurs with people who are adapting to a new sleep apnea mask, and it does occur with Halloween masks as well. Our brain is designed to protect us from suffocation or situations that could compromise our air supply. When this happens in situations that are not unsafe, we call these false suffocation alarms. Here's an example of a situation in which someone feels a false suffocation alarm. The person puts on a mask.
The person's brain senses a very small change in carbon dioxide levels and they start to feel anxious. The rate of their breathing increases. They now feel more anxious, and there is a release of adrenaline into the body. The person becomes even more short of breath, and they begin to panic. At this point, the mask is removed. Once the mask is removed, they begin to calm down. Panic subsides immediately. Normal breathing then returns, and the person comes to the conclusion that the mask was making me sick or the mask was suffocating me. Therefore, I can no longer wear a mask.
Fear of suffocation while wearing a mask is very real, and feeling unwell while wearing a mask is also very real. But masks are not dangerous, and masks will not cause you harm. We need to overcome this anxiety and this difficulty. I'm going to show you how. Exposure therapy is a strategy to extinguish the fear that arises when you feel like your breathing is obstructed. This strategy will help to teach your brain that the mask is not an obstruction to your breathing. We are going to explore a strategy called box breathing. Start by doing this with the mask over your face. So you can sense the mask is there, but it's not actually touching your face. This way you can still feel your breath into the mask. Close your eyes. Breathe in through the mask slowly. Count to 4.
Step 2. Hold your breath inside while counting slowly to 4. Try not to clamp your mouth or nose shut. Simply avoid inhaling. Step 3. Begin to slowly exhale for 4 seconds. Step 4. For 4 seconds, keep your lungs empty before beginning the next breath. Repeat this cycle for a good 4 to 5 minutes.
If you do feel anxiety, remind yourself that you are not suffocating and you are not in danger.
Keep breathing slowly and deeply until anxiety resolves. Repeat this until you have the mask and ear loops on and can remain calm.
Continue this exercise for at least 4 to 5 minutes or until you don't feel any more anxiety. Together, we can practice how to wear a mask and feel more comfortable, reduce our anxiety, and be calm when we go out in public and we do wear a mask. I'd like to encourage you to watch my mask video on appropriate and proper use of masks. It shows when we should use a mask and how we should use a mask. It also shows how to take care of your mask. And it's only 2 minutes. Thank you very much for joining me. I look forward to seeing you again. Bye-bye.